Okay, a flail chest is something that results when you have several rib fractures. So you've got multiple rib fractures, multiple ribs that are fractured in multiple different places. And so when that happens, your ribs become and your chest become very unstable. It can also happen if you have a fractured sternum with some fractured ribs. So with the flail chest, one of the things that you're going to see is paradoxical breathing. So anytime you have somebody who's been in any kind of a traumatic accident or that has bruising to their chest, and then you see that paradoxical breathing, you're going to be very concerned that they might have a flail chest. Anytime you see paradoxical breathing, it always means that there's a problem with your lung or your diaphragm. So again, any kind of neurological injury or neurological problems or injury, direct injury to the chest can cause that. There's many other things too, but those are some of the more common ones. So normally when you breathe in, your chest goes out, and during expiration it goes back in. When you have a flail chest, just the opposite happens. So when you inhale, your chest actually goes in, and when you exhale, your chest actually comes out. So that's what we mean by paradoxical breathing. So it is, so what are we going to do about that? Well, we want to make sure we're adequately ventilating them, that they're able to get good oxygenation and ventilation. They usually have an increase in their work of breathing because of this. They've got slow or rapid shallow respirations. They may be tachycardic. Sometimes they will actually even attempt to splint themselves, do self-splinting to try to breathe, so that, again, some of it's to help with the pain. So, and it's pretty apparent. You can see it sometimes in kids, younger kids, because all of their musculature isn't developed yet. If they're under 2 or 3-ish, you'll see what looks like paradoxical chest movement, but that's just normal breathing for somebody that age. But when you get into your older adults, older kids and adults, any kind of paradoxical chest movement is very concerning. So how do we treat that? We give them adequate oxygenation. We're going to try to facilitate lung expansion and make sure we've got adequate oxygenation. You may need to give them pain medicine so that it will encourage them to breathe. So if I hurt, I'm not going to want to breathe. If it's really, really bad, in some severe cases, they'll actually have to do mechanical ventilation. And they may even have to go to surgery and have those ribs stabilized so that you don't have all that movement going on. Obviously, fractured ribs can be a big problem, because if I've got a rib that's broken and when I breathe it goes, I can poke a hole in my lung, and then I get a pneumothorax, which is a whole other set of issues I don't really want to have to deal with. So again, anytime you have trauma or bruising to the chest and you see that paradoxical chest movement, you're going to be thinking, I've got a flail chest.